Human immunodeficiency virus, also known as HIV, emerged in 1983. HIV belongs to the family of Retroviridae and the genus Lentivirus. HIV can be divided into two subtypes, HIV-1 and HIV-2. HIV-1 is the most prominent in humans, therefore it'll be our main focus. HIV-1 can be divided into three groups, main, outlier, and non-main or non-O. Main makes up 95% of global HIV infections. It can be broken down into 13 recognized subtypes, with B being the most prevalent in North and South America, as well as Europe. In 2013, approximately 33 million people were infected and living with HIV. Characteristics: two identical strands of RNA. It uses enzyme reverse transcriptase. What this means is that the RNA enters the host cell and an enzyme is used to read the sequence, converting it into complementary viral DNA. It's enveloped in phospholipids, as well as has glycoprotein protrusions. Is very small, approximately 100 to 120 nanometers.
So tell me more!
Well, HIV actually attacks your immune system, specifically the CD4 T helper cells, which will result in the immune system's inability to differentiate between self and foreign cells.
So how does it get into the cell?
Well, the first step is through attachment. The glycoprotein protrusion attaches to a receptor on the CD4 T helper cell. Once the attachment is made, core receptors aid in the movement of the virus into the cell. This process is called fusion. Once the virus enters the cell, an entry port is created, leaving behind the viral envelope. This allows for the virus to uncode, releasing the RNA for synthesis.
HIV is transferred across mucosal membranes by transfer of or direct contact with bodily fluids, for example, blood or serum. The most common forms of transfer are intimate sexual contact, breast milk, contaminated needles, organ transplants, blood transfusion, and mother-to-fetus transmission. There are 3 stages of the HIV infection process. In stage 1, within a few weeks, billions of your CD4 T cells will become infected. Your immune response and number of uninfected cells will decrease, resulting in an asymptomatic progression. In stage 2, the number of T cells, along with your immune response, will continue to decline. Only a relatively few infected cells release HIV, although many contain viruses in latent form. In the 3rd stage, the infection has advanced to the point where nearly 20 million T cells die per day.
AIDS can develop in HIV patients during the 3rd stage of transmission. At this point, nearly all of the patient's CD4 T cells have become infected. Our normal body has 800 to 1,000 CD4 T cells. When someone with HIV has a count less than 200 CD4 T cells, they are considered diagnostic for AIDS. This takes approximately 10 years. Indications can be C. albicans infections, also known as yeast infections, in the bronchi, trachea, and lungs, cytomegalovirus, eye infections, tuberculosis, pneumocystis, pneumonia, toxoplasmosis of the brain, and Kaposi's sarcoma.
These diseases are caused from the inability of T cells to produce cytokines, therefore decreasing the immune system. There are also very few unaffected T cells present, making what response they have insignificant.
What does HIV look like?
Well, some of the signs and symptoms can be rather delayed, but they may include fever, fatigue, rash, headache, lymphadenopathy, pharyngitis, arthralgia, myalgia, night sweats, gastrointestinal problems, aseptic meningitis, and oral or genital ulcers.
So, how do you test for HIV?
Well, we use a form of serology called Western blotting, also known as immunoblotting, which is used to detect how certain proteins react with antibodies, confirming the HIV infection.
How can I protect myself from HIV?
Well, many methods include HIV screening, male circumcision, correct and consistent condom use, clean needle use, as well as antiretroviral therapy to prevent initial and mother-to-child transmission.
So how do you treat HIV?
Well, there are different types of therapies. Some include antiretroviral therapy, which is an anti-HIV medication. This disables or stops proteins from making more copies of HIV. It also disrupts building blocks needed for viral replication, or it can block entry of viruses into cell. Another form of therapy is highly active antiretroviral therapy, also known as HAART. This uses 4 antiretroviral medications concurrently to reduce the plasma HIV RNA to the smallest amount possible. There are different classes of antiretroviral drugs that can be used, including nucleoside reverse transcriptase inhibitor, also known as NRTI, non-nucleoside reverse transcriptase inhibitor, NNRTI, protease inhibitor, nucleotide reverse transcriptase inhibitor, RTI, fusion inhibitors, and lastly, integrase inhibitors. How does HIV affect healthcare workers?
Well, the primary concern with healthcare workers is disease transmission. It is crucial as nurses we understand how HIV is spread in order to protect ourselves from transmission. Risk of infection from needle stick injuries for healthcare workers is 0.3%. Following all safe needle disposal protocols and wearing appropriate PPE will reduce this risk. As healthcare professionals, if you are exposed to HIV, PEP is available. PEP is post-exposure prophylaxis, which is 3 days of antiretroviral medicines to reduce the chance of infections. It is also important to understand that with treatment and proper prevention strategies in place, one can survive and live a normal life with the HIV.